saying that the law is on the trail of the perpetrators.
In cases where we have challenges such as we had in Trans Nzoia, we have nothing to hide as government and the security sector. All of our colleagues, including in the police force, operate under very well established standing orders. The standing orders prescribe the extent to which you can use, live ammunition. The sad incident that happened in Marsabit, I am happy that we have now apprehended the principal actors. You cannot kill a chief in that wanton, cold-blooded way it was done in Marsabit. I said this in Nyeri, when a chief was killed in Nyeri by criminals, that if you challenge government by committing crime in such a blatant manner to the point of actually targeting public sector officials, you have invited us to do our work and we will do it for sure. And in that case of Marsabit, our security team is on the ground. We moved RDU and a platoon of GSU to the ground. We will do our work in that area. We will follow the perpetrators of that act to the end of the earth until we apprehend all of them and bring them to justice.
All right, that's the latest in terms of security matters touching on the Transport Department. Let's just cross over to Nyeri County right now. And this is an event touching on universal healthcare that is set to be launched, or rather that is set to benefit the residents of Nyeri County. Let's take a look.
Seeking UHC. And what this one will do is that at that level, which we have strengthened, using the funds that have been given to us by national government and our own funds, which we have increased by 200 million. We've been able to provide the necessary and requisite drugs at those facilities. The first, that is the first call, the first center or the first call, place that you call, of call where the patient is attended. Having been attended at the dispensary level, it is important that our patients appreciate the fact that most ailments can be dealt with at the dispensary level, where you'll either find a nurse or you'll find a clinical officer who will handle the ailment. Where the ailment requires further treatment, the patient will be referred to the next level, which is the health center. And at the health center, you will find a bit more advanced treatment and for the ailment. And this one will undergo, I mean, you'll also meet the clinicians and they will treat them. And if there will be a need now to refer the same ailment or the same patient to the next level, the patient will be referred to the level 3s. I mean, to the level 4 hospitals, because level 3s are health centers. And that is where we have Mount Kenya Hospital. We also have Karatina District Hospital. We also have the sub-county hospital at Mukuroine and Mount Kenya. Those 4 will now be the level 4s at which now this patient, who has come all the way from the health center, I mean from the dispensary, will now get even further advanced treatment. All along from the dispensary, coming all along up to the level 4, no payments will have been made. If the ailment continues and now there is need now to be referred to the next level, which is the highest we have in the county, that will be the county referral hospital, the level 5. The patient will be referred to the level 5 and will also be treated as this patient has come all the way up. There still will be no payments. That is what UHC envisages. But it is important that we say this universal health coverage will only work when we allow the referral system to work. Yesterday and in the days that have since the launch, we have seen a huge surge of numbers in the county referral hospital, usually known as the PGH. And I think it is important that we tell the people of Nyeri that if you land in PGH, if you land at the county referral hospital today, without a referral, you will be charged. so that it is so clear. They need to know that we are not prepared to handle you at the county referral hospital unless you have been referred. It's not the first point of call. And so we want to urge all the citizens of Nyeri, please, every one of us who has been registered is attached to a certain dispensary. That should be the first point of call and the first place you should report to when you need to be attended to. And then we should allow ourselves to go through the referral system where you start at the dispensary, where the need arises, you go to the health center. From the health center, you go to the level 4, and from the level 4, you may go to the level 5. Then what happens at level 5? Once we are now certain that the ailment cannot be treated at that level, we will refer you to the other level 6. We hope Odaya will be coming up soon. But in the event Odaya hasn't started off, we will refer you to Kenyatta and other hospitals. Kenyatta, Moi Teaching and Referral.
All right, live pictures right there as Mutahi Kahiga, that's the Nyeri County Governor, brings us up to speed with the state of the universal healthcare pilot phase in that particular county, Nyeri County. Remember, it's not just the county that's benefiting from the universal healthcare. Isiolo, Machakos and Kisumu as well had been chosen to be the counties where the pilot phase of the universal healthcare will be launched, just to take a look at how successful it is before it's rolled out in all the other 47 counties. Let's move on. Boda Boda operators now have to May the 1st, 2019 to adhere to all traffic regulations and safety requirements. This means they now have a 4-month grace period, up from February 1st deadline initially set by the task force on reforms in the sector continues to engage with the government. Among requirements demanded for all include that the Boda Boda riders should have a riding license apart from the safety gear, including helmets at all times.
Licensing and acquisition of the necessary accessories that touch on safety, that the deadline of 1st February 2019 has been extended to be 1st May of 2019, just to allow them time to do that. In the meantime, all the boda operators will be expected to obey the law. They'll be expected to ferry one passenger at a time. They'll be expected to ride motorcycles that are in good mechanical conditions, and that shall continue being enforced.
For us, we shall focus very much on making sure that we maximize the training of the border borders in the next 4 months through NTSA, to make sure that people who got their licenses, they are getting their licenses in a proper manner, to make sure that they follow the law.
As the legislature, to our executive arm for the extension that has been given to the border sector until the 1st of May to comply. And as leadership and political leaders, we are now going to be working together with our border riders to ensure that by 1st of May, we will not come back seeking for another extension, but by 1st of May, we will ensure that our border have the licenses, they have all the protective gear, they have the insurance, and so that as they ride, they are safe. And for them to understand that all this that is being done is not for anything else, but to ensure their own safety, and so that we ensure that we are not losing lives unnecessarily. But we are also very happy that we have had discussions on the pro-boxes and the centers and how we operate our transport sector within the rural areas, and that these matters will be resolved both by Parliament and the executive.
Interior Cabinet Secretary